All right, jumping right in. Today's deep dive is going to help you guys prep for those MRCS exams.
We're going to be tackling a topic that comes up all the time:
Oh, for sure.
diabetic patients in surgery.
Yeah, so this is, I think, a really important topic, so let's get straight into it.
Let's do it.
So first things first. When we're talking about diabetic patients, they are at higher risk in surgery.
Absolutely.
So why is that?
Well, diabetes, it's not just one thing. It affects pretty much every system in the body. And all of those things then increase the likelihood of complications during and after surgery. So you've got your cardiovascular issues,
Right.
hypertension, atherosclerosis. All those things can affect how well we can control their blood pressure during surgery.
So those are definitely things that we need to be, aware of and keep an eye on.
For sure.
What about other systems?
Well, we worry about the brain as well.
Okay.
The cerebrovascular events, things like strokes are always a concern.
Right.
And then there's the peripheral vascular system.
Right.
You get macroangiopathy. You can even get gangrene in diabetic patients. And this compromises blood flow to the tissues, so wounds just don't heal as well.
And that's a big problem when we're thinking about surgery.
Huge problem.
Yeah.
What about the kidneys?
Yeah, that's another one, right?
Diabetic nephropathy is a real issue. It affects how well the body removes waste products, impacts fluid balance, and this all plays into how we dose medications and even what kind of anesthesia we choose.
Okay, so we've got cardiovascular, we've got cerebrovascular, peripheral vascular, kidneys. Anything else?
Eyes.
Oh, of course, the eyes.
Yeah, we can't forget about those. So diabetic retinopathy, cataracts, those pre-existing conditions all need to be carefully considered before surgery.
It's a whole body disease, isn't it?
It is. And metabolically, we're always worried about hyperglycemia, ketoacidosis.
Yeah.
Those things can really set a patient back in terms of recovery.
Okay, and we've also got the nerves and the skin to think about.
Absolutely. So diabetic neuropathy increases the risk of pressure sores, especially during long operations. And that, on top of the impaired wound healing and increased infection risk from diabetes, well, postoperative care is just that much more important.
Okay, so let's say we've got a diabetic patient coming in and we're thinking about operating on them. How do we approach that preoperatively?
Well, first and foremost, you've got to understand how well their diabetes is controlled. That means a really thorough evaluation.
Okay.
We're trying to prevent hypoglycemia. We're trying to prevent ketoacidosis. Those things can be really dangerous during surgery.
Right, so how do we go about assessing that?
You've got your routine blood work, which is essential.
So what are we looking at?
Group and save, full blood count, your electrolytes, glucose, CRP, fasting glucose, and glycated hemoglobin or HbA1c.
Right.
So all of those tests give us a complete picture of their health and tell us how well they've been managing their diabetes.
So for example, the UNEs, that gives us a sense of how the kidneys are doing, which we know can be affected by diabetes.
Absolutely.
Okay, perfect. Anything else we need to think about pre-op?
Scheduling is key as well.
Right.
We try to minimize their fasting time as much as possible and schedule diabetic patients early in the day.
That makes sense.
Yeah.
We're trying to avoid those long stretches without food or meds.
Precisely.
Yeah.
Now, how we manage their diabetes medications pre-op depends on what they're normally on.
Okay.
So say someone controls their diabetes with just diet. If they're having minor surgery, we don't usually need to change anything.
Okay.
But for major surgery, we watch their blood glucose like a hawk.
Mm-hmm.
And if it starts to rise, we'll use a sliding scale with insulin.
So basically that means we're adjusting the insulin dose based on how their blood sugar's doing.
Exactly.
Regular checks.
Regular checks. What about those on oral hypoglycemic agents?
Right. What about them?
Well, for minor surgery, they can usually skip their morning dose and restart it once they're eating and drinking again.
But we're still monitoring that glucose.
Right. You got it. Closely. For major surgery, though, we usually switch them to a sliding scale insulin regimen while they're NPO.
NPO meaning nothing by mouth.
That's right. And then we stop it once they can eat and drink normally again.
Okay, so that's diet-controlled oral medication. What about insulin-dependent diabetics?
We hold their normal insulin while they're fasting,
Okay.
no matter what type of surgery.
Okay.
And then we start them on a sliding scale insulin with a dextrose infusion. This helps keep that blood sugar stable.
Mm-hmm.
We can stop that once they're eating and drinking again.
Right, so that's pre-op sorted. Now we're in the operating room. What are the intraoperative things we need to keep in mind with a diabetic patient?
Remember, both anesthesia and the stress of surgery itself can make blood sugar levels go up.
Right.
So if we can, we like to use local, regional, spinal, or epidural anesthesia because these tend to have less of an effect on blood sugar compared to general anesthesia.
So general anesthesia is less ideal.
Not necessarily. General anesthesia is usually fine, but we just need to be super careful with monitoring.
Okay. So what are the main things we're monitoring during surgery?
Blood pressure and blood glucose.
Of course.
Absolutely.
Hmm.
We need to be checking those regularly throughout the entire operation
Okay.
to make sure everything stays stable.
All right. We've got them through surgery.
We're almost there.
Last but not least, post-op management. So what's the goal here?
The main thing is keeping those blood glucose levels in a normal range. That's essential for good healing and to prevent any nasty complications.
So how do we approach their diet and their regular meds post-op?
We start slow.
Okay.
We'll begin with oral fluids, move on to a soft diet, and then gradually reintroduce their usual diabetic diet as they recover.
Okay.
And we can restart their normal medications,
Right.
but we need to be ready to adjust the doses based on their blood sugar readings.
Got it. Any other post-op things we should be extra cautious about with diabetic patients?
Definitely. Diabetic patients are more prone to infections.
Oh, right. Of course.
So we need to keep our eyes peeled for any signs of infection and act quickly.
Treat them promptly.
Absolutely.
Okay, awesome. So that was, I think, a really great deep dive into managing diabetic surgical patients.
I agree.
Really helpful for our listeners. And as you were saying, each patient is different.
They are, yeah.
So we need to think about their individual medical history and adjust our management accordingly.
Exactly.
This framework is a great starting point. And I think thinking about those different scenarios, like, okay, what if this was an emergency surgery?
Yeah,
How would you manage things differently? That's the kind of thing that's going to be really valuable when you're sitting those MRCS exams.
for sure.
Well, thanks for joining me,
No problem at all.
and we'll see you guys in the next deep dive.
See you later.